The other question I had about the next pandemic and the one we just had is, why not have committees of people of diverse backgrounds, socioeconomic diversity, racial diversity, every aspect of diversity, rather than individuals standing there telling us what to do for several reasons. One is we are a country of many different people.
Yeah.
I think there are dozens, if not hundreds, of scientific papers showing that patients follow the advice of doctors that look like them and sound like them, or to whom they would aspire to be like.
Yeah.
We know this.
Mm-hmm.
And yet public health officials typically are unitary. One person telling us, do this, don't do that. This is a good idea, that's a bad idea. I'm but one citizen, but I'm putting up both hands, both feet, and all toes and saying that committees, small but diverse committees that people can relate to and feel as if the messages that they're getting are vetted through a common understanding.
Yeah, so it's a really good suggestion. And I couldn't agree with you more that a diversity of voices is really important to get a message out. During COVID, actually, that's one of the things that our office actually was helping to build, was something called the community core, right? Where we recognize so very clearly, and this is something I came to see as a doctor. Sometimes I was the right person to message to a patient. Sometimes I wasn't, right? Sometimes it was the nurse. Sometimes it was the medical student. Sometimes it was an administrator or the social worker who had different background, different life experiences. So part of this work is knowing when to step up, when to step back, right? But the community core that we were building was a really diverse, group of people. And a lot of them had public health backgrounds, but a lot of them were community leaders who understood health, even though they didn't have formal training. But they're people who knew their communities, right? And they had the trust of their communities, and they understood what was going on. They wanted to be helpful. So we brought them together to say, okay, look, here's what the science is telling us. Here are the general recommendations. Here's what we would provide. You ask us any questions you have, like if there's something we don't know, we'll go back and look it up. But you're the leaders in your community. They should be hearing from you, about these messages. And then those folks went out and actually we worked closely with them, collaborated with them. They would design the messages for their community based on what they thought made sense. They weren't taking what we said word for word, and we didn't want them to. But to me, like that kind of diverse approach is what we need more of. Now, I'll tell you what I would have liked. I would have liked if more media networks put those folks on TV and got them on the radio, right? Because it's important that many of them were showing up in their communities, were knocking on doors, were doing local, podcasts, et cetera. And that was great. But I would have liked more of their faces like carried on TV, right? So that's a place where when we talk to media and when I talk to folks in media, one of the things I encourage them and push them to do also is to say, look, if you can take more of these diverse faces and voices and put them out there, that's actually good for the community. And it also helps people see that it's not like one or two people who are sort of pushing an agenda here. This is like the public health community is big. It's broad, it's diverse, it has a lot of voices. And as the more voices we can hear from as public, I think the better off we are.
I genuinely hope and pray that we don't have another pandemic, but if and when we do, I hope there will be committees rather than individuals. I know this is a thing in this country. We like the idea that one person's going to save the climate, one person's going to save transportation, one person, the covers the person of the year type approach. But then we get frustrated when that person does things or makes decisions that we don't like in their public or personal life, and then it all seems to fall into division. And I just feel like we're not talking about groups of hundreds of people, but small groups.
Yeah.
So I think we're aligned in that way.
Yeah, and look, there's I think a notion that I think sometimes we do want like the one person who can not only necessarily have all our trust and we can look to, but also who we can hold accountable. If something doesn't quite work out, or we don't like something. And while I get that sort of mentality, I think that in this moment, especially when we're trying to rebuild trust, I think it's important for people to know that what they may be hearing in terms of medical or public health recommendations, it's important for them to know how broad an audience that's coming from, or broad a group of experts, right? And there was a lot more broad agreement, for example, during COVID and during Ebola, during Zika, on public health recommendations. But you wouldn't always know it if you turned on the TV, because you were seeing the same couple of faces. So I think we have to certainly diversify that. One other thing I think I'll tell you that's important here is I think we have to also think about how we fund groups on the ground that are doing the hard work of getting public health messages out. Because one of the things that those groups often would tell me, and these are, I might say the groups, I'm talking about the community organization that spent years in a neighborhood getting to know families, where folks recognize them when they're walking down the street. They're like, oh, yeah, that's a person from organization X. They understand us, they get us, they're looking out for us. A lot of those organizations had spent their resources helping the community, getting to know the community, but they didn't have sophisticated mechanisms to apply for grants, for example. They didn't have grant writers who had done this 1,000 times. So historically, those groups have a hard time getting support and funding. So I'll tell you one interesting thing my wife did, which I certainly was very proud of, is she was helping to build an effort and to build a nonprofit organization with a couple of colleagues, that a big organization of people who knew how to get money, how to apply for grants, how to get foundation support, but who also had the wisdom to know that the most important they could do was to give portions of that money to groups on the ground. So they saw themselves as an organization that channeled money to groups that had trust, and they executed their mission that way. And that was very effective. And I think we need more of that when it comes to disseminating funding. One thing I think many people may or may not appreciate is that it's actually hard from government to put out a lot of money at once and to do so quickly, right? Like when you've got a lot of funds that you need to get into communities, what happens is the federal government often will give it to states. States will then give it to local communities, to like the local Department of Public Health potentially, and then they will look to distribute it to others. That takes time, but it also means if you're not connected to that network, if you don't know your local Department of Health or you're not connected to the state Department of Health, sometimes it can be challenging to figure out how to get the money. And so I think we need more operations like what my wife and others have been building to try to get those funds directly to the folks you don't necessarily have the most fancy, grant writing operation, but they have the relationships. Because at the end of the day, it's those relationships that create the trust. It's a trust that allows life-saving information to get to people. And that's the link that's missing.